Today at the Rangiora Vet Centre, Rebecca is performing surgery on Clyde the dog.
I'm Rebecca Waite, I'm the consultant orthopedic surgeon here at RVC, and we've just got wee Clyde here who's just about ready to go through to surgery. He's ruptured his cranial cruciate ligament, or what's called the ACL in humans. Pretty common injury in dogs. It's the most common orthopedic injury of dogs. Very, very painful, as I'm sure people who have suffered an ACL rupture know, and definitely best treated with surgery. So wee Clyde's leg is all prepped up, sterile. He's anaesthetised. He's hooked up to his anaesthetic machine. He's got a warm air blanket on, and we're monitoring his blood pressure, and he's having fluids and painkillers through his drip. His wee knee has had all the hair clipped off so that we can reduce the chance of him catching an infection from his skin bacteria during surgery. And we can see, having a wee look at his knee here, he's got quite a lot of instability here between the two wee bones of his knee. You can see that moving back and forward there, and it shouldn't really be moving at all. There should be movement between the shin bone here and the thigh bone here. We've got a model of a much bigger knee here. This is probably a Labrador-sized knee. The cranial cruciate ligament lives right inside the joint in here and stops the movement of the shin bone forward against the thigh bone. There should be no movement in that direction. When that ligament does rupture, every time the dog stands on his leg, the shin bone shoots forward and almost dislocates a little bit, so it's obviously very painful. And there's several different types of surgery that can be done for this injury, and the one that we're going to do on Clyde today is called a triple tibial osteotomy. It involves redesigning his knee a little bit so he doesn't have any movement between these two bones when he stands on his knee. So we need to do quite a lot of x-rays and measurements and planning to make sure we do this correctly for Clyde. So we can go through and have a look at his x-rays and see the pre-ops planning that goes into this surgery. So it was before he had a very steep bearing angle on the surface of his shin bone. Now he's got a really shallow one because we've tilted the whole thing forward, made some cuts here and put a big plate on, and he's got 6 wee screws in there if we look at it from the other angle. 1, 2, 3, 4, 5, 6, holding those cuts in the bone in place while they knit back together again. And I'm happy with those x-rays, everything's in the right place. I haven't put any screws anywhere that I shouldn't have. So we're just going to go get him bandaged and make sure he wakes up comfortable. This is that bony bump that we were looking at before, and when we put some weight bearing through his knee before it moved forward. Now with the angle changes that we've made, it doesn't move forward when we put weight bearing force onto his knee. So he's aware of what's going on with him now. He's responding to touch. He's wrapped up in his warm air blanket still, and he's still receiving all his pain medicines through his drip. And we just spend quite a bit of time with these guys over the day, just gently touching around where their surgery site is. So we're not squeezing very hard, but we just want to test to make sure he's not sore. So just very gently touching and squeezing his leg through the bandage, and he's not reacting to that at all. So we're very happy that he's comfy, and we'll just keep doing that every half hour or so and making sure that he doesn't need any more medications. In a couple of hours, when he's a little bit more awake, we'll offer him some lunch because he's probably starving. Hasn't had anything to eat since 9 o'clock last night, have you, mate? And hopefully he'll be going home tomorrow, back home.
Join us next week when Rebecca the vet introduces us to Nick, who has mobility issues.